Nearly 160,000 influenza-like cases have so far been recorded by the Health Department in 2023. That's amid reports of a surge in cases of respiratory illness in China, especially among children. The DOH says the number of flu-like cases is about 46% more than the yearly 109,000 reported in the same period last year. And to give us an update on this, we'll speak with Health Undersecretary Dr. Eric Tayag. Good morning, USEC. Thank you for joining us this morning here on New Day.
Thank you, and good morning, Dr. Freddy, Dr. Gomez. Thank you so much.
Great to have you here para maliwanagan ng ating mga viewers. Okay, let's first get an update about the number of flu-like cases recorded in the country. It was at about 160,000 last week. Is there an updated figure right now? Do we see an upward trend or something like that?
That was as of October 28. Now, as of November 11, it has climbed to over 180,000, Doctor.
Okay, now, USEC, are there areas in the country where the number of flu-like illnesses are higher compared to other areas?
It's all over the country. Every region has reported an increase since the start of the year. And while there has been a significant increase, there were no outbreaks that were reported, but there were some clustering of cases, and we expect more cases as the weeks will end 2023. And we hope that everybody understands why this is happening, Dr. Gomez, because we have been on a period of restriction, and many of us may not have the needed immune response to these viruses that include adenoviruses, respiratory syncytial viruses. And if you're going to ask me if we have Mycoplasma pneumoniae, as what was reported in China, so far this has not been reported simply because these are not being routinely tested.
Okay, you bring up an interesting point because you mentioned about Mycoplasma pneumoniae, or yun yung nag-uumpisa, or yun yung causative agents for what is people are hearing now as walking pneumonia. So far, like what you mentioned, wala pang nakikitang Mycoplasma dito sa Philippines.
We have reported it in the past, but doctors would start on empirical treatment once they suspect that a patient has Mycoplasma pneumoniae. It's a walking pneumonia because we don't get sick enough to require any hospitalization. But we are concerned, as well as the World Health Organization, because China has been reporting this in so many children, and many are hospitalized, and that currently antibiotics that are much for the Mycoplasma pneumoniae have higher drug resistance rates. We don't have data right now here in the country. So the layers of protection are very important, Dr. Freddy. So we have to wash our hands. We have to still observe social distancing. And for the senior citizens, pregnant women, wearing a mask is something that we know already. And that vaccinations against the flu, these are for free for senior citizens. And of course, we have to stay home if we don't feel well.
Right. Now, USEC, you have to understand a lot of parents may be anxious, maybe be concerned a little bit because we're seeing a trend na mas madalas itong nakikita sa mga bata. Are we seeing anything novel? Because, of course, we still have memories of the past pandemic, of COVID. One of the reasons why COVID was so devastating was it was a novel, it was something new. Are we seeing that? Are we seeing any signs that there is something new again?
That's the reason why that we have stepped up on our surveillance. We call it the influenza-like illness because it can capture any condition or disease that can actually mimic COVID or the flu. For our influenza-like illness cases, which I already reported more than 180,000, we were able to get some samples, and the most number of cases we confirmed were due to influenza A or influenza B. Then there's SARS-CoV-2 or COVID. And we hope that we continue to report this. And the good news is we are not able to report any new pathogen or viruses. The Philippine Genome Center is updating its report on the current circulating SARS-CoV-2 strains because right now in the United States, for example, there is a new variant of interest, the BA.2.28, although it doesn't behave differently from the other Omicron variants.
Okay. Now, should parents be alarmed? Should parents be concerned of bringing their kids to school now that they have news na yung mga batang naapektuhan nito? What advice can you give the parents who are concerned about their kids being one of those infected?
Okay, as long as the schools make sure that those students who are sick are not able to attend these classes and so therefore they stay home, then the school should be prepared for visual classrooms so that any student will not miss any classes, especially that we are ending the season for classes during the holidays.
Okay. Now, it might be a little bit too early, Yusek, but do you see a possibility na ma-impose ulit ang mandatory masking because of the rise in cases?
Okay, let me explain that the mandatory masking is not an option at this time, including any travel advisory that will limit travels to countries that are affected right now, not only China, not only in Europe, the Netherlands, or the United States, or even neighboring countries we don't know yet, except that we have to remind everyone that the Department of Health, even as the public health emergency was lifted, is still recommended that for senior citizens, pregnant women, and for those with medical conditions, and you are in closed settings where there is a bit of a crowd, that you have to wear your mask. Not only because you want to prevent yourself from getting infected, but also we can prevent infecting others because we don't know that we might be actually harboring any of the viruses I mentioned.
Okay, good advice there, Yusek. Balikan natin yung simple steps to avoid falling sick and being infected with this respiratory illness that's going about.
Okay, check your temperature as soon as you wake up. It's a nice habit to gargle some warm saline water. So a pinch of salt in a lukewarm water and we gargle that, especially those who are already experiencing some throat discomfort. And if you have colds and cough, that's the time to wear your mask and get your test so that we can rule out if we suspect COVID, for example. And then we have to watch out our symptoms as the day progresses because for Mycoplasma pneumoniae, Dr. Gomez, for example, cough could last for several weeks before it goes away.
Okay, thank you very much. So aside from masking, although it's not mandatory, it's always a good idea to mask. Hand washing, as you mentioned, is also, these simple things can go a long way in trying to prevent disease from spreading. Thank you so much, Yusek Eric Tayag, for joining us here and giving us an update on this current situation.
Thank you so much. Stay safe, everyone.